Good morning. I'm Lydia Shapira. I'm a medical oncologist and professor of medicine at Stanford and the director of the Cancer Survivorship Program, and your host for today's fireside chat on mental well-being for cancer and beyond. Let me introduce today's co-hosts. Parul Somani is a business leader with experience in management consulting and operational roles at startups, and she's the founder and CEO of Silver Linings. As a cancer survivor and caregiver, Parul works with organizations and also advocates for patient empowerment, the power of genomics, and healthcare transparency and access. She authored a blog, New Job, New Baby, New Cancer, throughout her treatment, which has now been read in 85 countries and has been honored by cancer advocacy groups. And Martin Inderbitzin, a neuroscientist, online content creator, and triathlete. In 2012, his dreams of a successful career were destroyed by a pancreatic cancer diagnosis. And since that time, Martin has been in and out of treatment to cope with his chronic disease. Based on his personal experience, he founded mysurvivalstory.org, an initiative that documents inspiring cancer survival stories around the globe with the goal of helping other patients and families to cope better with the challenge and its psychological side effects. Let me turn it over to Martin, who will introduce our guest this morning, Dr. David Spiegel.
Well, thank you so much, Lydia. That's a pleasure to be here. And I have to say, Parul and I, we are very excited about today's session because we have a very, very special guest for you today. Dr. David Spiegel is a Wilson Professor and Associate Chair of Psychiatry and Behavioral Science, Director of the Center on Stress and Health, and Medical Director of the Center of Integrative Medicine at Stanford University School of Medicine. Dr. Spiegel has more than 40 years of clinical and research experience studying psycho-oncology, stress, health, pain control, psychoneuroendocrinology, sleep, hypnosis, and conducting randomized clinical trials involving psychotherapy for cancer patients. Today, he's going to talk to us about the power of hypnosis and social support in helping people to cope with stress. Dr. Spiegel, it's a pleasure to have you. Welcome to this online session.
Thank you very much, Martin and Parul. I'm very glad to be here. And you get to a point in life where your very kind introductions begin to sound like your obituaries. So I thank you for it.
Yeah, no, it's really impressive. Yeah. I mean, when we got ready to prepare this talk, it's really impressive what kind of work you have done in the past decades. And not only we, but also the whole audience is really excited to hear more about your research and what you did. So we thought it's a good idea to just start with the really basic, with the beginning. So maybe you can explain to us and the audience what is actually stress and why do we struggle so much to cope with it?
Well, stress is a natural part of life. We evolved as a species to deal with stress. If we didn't deal with it well, we wouldn't have evolved. And the only people who really don't have any stress at all are people who are dead. Stress is a part of life. And our brains are wired to pay attention to novelty, to new things that might pose a threat and figure out what to do about them. The problem for us has been that we've evolved to have a stress response system that's mostly physical. So you see a saber-toothed tiger, you get ready to fight or flee. Your blood pressure goes up, your heart rate goes up, your muscles tense, you start to sweat. And that's good if what you have to do is fight or flee. But most of the stressors we deal with now are more psychological. They may be physical, but as with a diagnosis of cancer, there's something that may come down the road, may not, but it's an ongoing, but not an immediate physical threat. And so part of the problem in dealing with stress is that we react to it physically, but what we really need to do is react to it better mentally and less physically. Find ways to keep that snowball effect from happening where you worry, your body gets tense, you think, oh, this is really bad. You worry some more, your body reacts. So it's a matter of recognizing that stressors are a part of life, that learning to deal with them is a very important coping mechanism, but how you do it makes a big difference.
Thank you for that. In our last session with Dr. Alia Crum, we talked about why mindsets matter. And in that, she specifically referred to the stress paradox. So like you referred to stress, stressors, things we have to cope with, the connotation around stress has always been so negative. And yet with the stress paradox, it sounds like there may be situations where stress could be helpful as well. Could you speak a little bit to the perhaps different types of stress, or what types of stress or at what times could stress actually be a good thing?
Well, yes, I like very much the way Dr. Crum talked about seeing stress as an opportunity, as a kind of wake-up call to handle something differently and potentially better. And there are, stressors are not necessarily pleasant, but they're often necessary. And if you look back in your own life, and it's one of the things I encourage people with cancer to do, is to look at their history of having dealt with and overcome problems in the past and learn to use that as a way of preparing yourself to deal with problems in the present and in the future. And so stressors are things that call on you to rethink your assumptions and take a different approach to a problem that you're confronting. So I often, to give an example that is a common problem for people with a diagnosis of cancer, is often some of the worst times are waiting for the results of a scan or a new test, because you're sort of immobilized. Part of what makes good stress adaptation is having a plan of action, deciding what you're going to do about the problem. And so I often advise people who are sitting there worrying, what if the scan is, I hope it's negative, but what if it's positive? To say, okay, what if it is, what will you do? And it doesn't mean it will be positive, and you're not making it any more likely to be positive by thinking that way, but you are feeling prepared. You're saying, well, I'm going to call my doctor. I'll probably have to come in for another scan. I'll probably have some blood tests, but this is what I'm going to do. And most of the time you feel better just having a plan of action to deal with the stressor.
I like that very much. I mean, we cancer patients, we often also connotate this situation as scanxiety, like the anxiety of a scan, and it really is a thing. I mean, when I talk with the community, it's like many patients are struggling with that. And so I like your example of making a concrete plan, like what you're going to do if it goes wrong or if it goes well. Now, I'm just curious, because what you said in the beginning is very interesting, that like stress is something that we respond in the body, but we have somehow to change like how we respond in the mind. Now, when I'm sitting there in the hospital and I'm nervous and I'm having anxious thoughts, it's sometimes tricky to remember that, or like I'm so physical. Like, what can we do in those situations to not forget that?
Well, there are a number of things you can do. Let me first say that I so admire what both you and Parul have done in being so public and direct about how you have been dealing with your illnesses. And I think it's just a tremendous service to everybody that you're so willing to share what you do. And part of it is, in a way, you're setting an example for how to handle this stress. And first of all, you're normalizing it. You're saying, it's not that there's anything wrong with me for worrying about what the effects of this might be. In fact, what I need to do is find a way to live with this new normal of things I have to cope with that 2 years ago or 5 years ago, I never thought I would have to cope with it. And so part of it is harness your physical arousal in developing a plan of action. So part of it is making normal the fact that you're aroused and worried. So, okay, I am, what am I going to do about it? The second, and I think we'll talk about this a little later, is there are techniques you can develop to separate your physical from your mental distress. So you can, just because you're worried about something doesn't mean your body has to be worried about it. So you can do a simple self-soothing technique of imagining that your body is somewhere else safe and comfortable where you like to be and feel comfortable. And as you do that, your body feels better, even though you're thinking about what it is you need to do. And that makes it less stressful for you to deal with the problem.
I really like what you said about the awareness element of just being aware that you might be under stress, and how you spoke to it just now has to do with the mind feeling the stress, but that your body doesn't necessarily need to. Oftentimes for people, it can actually be the flip, right? Where they're so immersed in the hardship that they're facing, whether it be a cancer diagnosis or stress at work, that their body is actually experiencing stress, even if though they haven't become mentally aware of it. What would be some of those physical manifestations of stress that people should keep an eye out for and recognize that like they need to be addressing?
Well, Martin mentioned one of them. You just find yourself feeling restless. You're sort of moving around, fidgeting. You feel that sense of tension in your body. Your muscles get tense. You may actually start to sweat. You breathe faster, but more shallowly. And actually, often one way to calm yourself very quickly is to exhale slowly, to just take a breath and then slowly exhale. And what you're doing there is actually stimulating the parasympathetic nervous system that slows your heart rate and blood pressure. So rather than hyperventilating and getting even more tense, you just slowly exhale and just see calming your body as one of your coping mechanisms. It's something that will actually help you deal with things better. The second thing to keep in mind is even within our brains, there are two fundamental operating systems that sometimes fight with each other. And one of them is at the base of the brain. It's in the amygdala, part of what we call the limbic system, the emotion system. It is active when you're feeling angry or fearful, and it tends to shut down your thinking ability. And we've all had that experience where you were so overcome with anger or fear that you didn't know what to do or what to say. In fact, we talk about speechless terror. If you see people at moments of terror, like 9/11, they're literally putting their hands over their mouths. They don't know what to say. And you want your cognitive system, your prefrontal cortex, to be working so that you can figure out what to do. And the emotion system can shut down the cognitive system, but the cognitive system can also control the emotional system. And so if the cognitive system can say, okay, this is really bad, but it's very important that I figure out what to do in the face of it, that can help you handle the stress a whole lot better and keep your body calmer as well.
Now, before we dive into the topic of hypnosis, and I know you have some special tricks ready for us, how we can actually do that to
Yes.
calm us down ourselves. I just want to add another question or ask you a question regarding the impact of stress. You quickly talked now a little bit about how it impacts our prefrontal lobe, how it affects our brain. What about our bodies? Like, how does stress affect our body, or does it actually has an influence on the prognosis of cancer, or how it affects the immune system? Like, how is that connected? Why is it so important to keep an eye on stress?
Well, the main reason is to just cope with stress better and feel better in the course of dealing with it. But there is some very interesting evidence that suggests that better stress management can help you live not only better, but potentially live longer too. And it's not a matter of, like curing cancer in your mind and all this, but it is a matter of, if you think about it, there's the cancer in your body, but there's also your body's resources for coping with the cancer. And that includes the hormone system, cortisol, which is one of the two major stress hormones in the body that mobilizes glucose in the blood and prepares you to fight or flee. The adrenaline system, which also increases your heart rate and blood pressure. And those systems can help you, but they can also interfere. And we found, for example, that women with breast cancer who have abnormal patterns of cortisol, this is the stress hormone that raises blood sugar, normally it's highest in the morning and it goes down throughout the day, so that by the evening, your cortisol levels should be a quarter of what they are at their peak at 8 o'clock in the morning. And that diurnal rhythm helps prepare your body for the day, get you mobilized from sleep, but also keeps you from burning resources you don't need to burn later in the day. And tumors actually selectively take glucose from normal cells. So having abnormal levels of glucose throughout the day is not a good thing from the point of view of fighting the cancer. We found that women with these abnormal patterns, where it stays high throughout the day, actually over the long term have shorter survival than those with normal patterns. And again, it's not a matter of curing cancer or not, it's a matter of the course of cancer. So there are things that you can do to help normalize your stress response that certainly help you live better and might even help you live longer. And so the idea of, I tell my patients to do what your grandmother told you to. Eat well, sleep well, and get plenty of exercise. In other words, you're in training to live the rest of your life. And just the way an athlete would train their body to perform optimally, cancer patients can do that too. And that will make you feel better for sure. It might help your body cope with the illness as well.
So that's great. It means we have something in our hands, no, Parul?
Yeah, absolutely. Well, we know a lot of Dr. Spiegel's research is on the topic of hypnosis and the role that it can play in managing stress and helping us calm ourselves. And can you start by actually just explaining to us, Dr. Spiegel, what hypnosis is and what's even actually happening to our brain if we were to be hypnotized or learn how to, self-hypnotize?
Sure, Parul. Hypnosis is something like getting so caught up in a good movie that you forget you're watching the movie and you enter the imagined world. It's been called a suspension of disbelief. It's a state that most children are in most of the time. Your 8-year-old is outside playing and you call them in for dinner. They don't hear you. Work and play are all the same for kids. It's why we kind of ruin them by training them to be adults. They love learning anything. But gradually, many of us lose some of that ability throughout adolescence. And so not everyone, but about 3/4 of most adults are at least somewhat hypnotizable. Hypnotizability in adulthood is as stable a trait as IQ. So it persists over time. But it means that many of us can get so absorbed in doing something that time just passes, we don't notice it. We don't judge it, we simply experience it. And so there are other times when you may, after the movie, think, well, actually that script didn't make a whole lot of sense and that actor wasn't so good, but at the time you're just in it. So if you have the ability, we all to some extent go into this kind of state of highly focused attention. It's like looking through a telephoto lens in a camera. What you see with great detail, but you're less aware of the context. And it's a very powerful state to help people manage stress, anxiety, pain, help change habits. It can be a surprisingly effective tool.
And so how can we get into that state? Can you give us a little demo? Is this possible here online or how is it?
Absolutely, it is possible online. So if you would like, I'll be glad to give you a little experience of it. And for those who are watching, feel free to just observe if you would like. But if you'd like to have a brief experience of hypnosis and see what it's like, here we go. And I promise that you will come back. So get as comfortable as you can. On one, do one thing. Look up to the top of your head, all the way up, high as you can. On two, do two things. Slowly close your eyes and take a deep breath. And on three, do three things. Let the breath out, let your eyes relax, but keep them closed and let your body float. Just imagine that you're floating somewhere safe and comfortable, like a bath, a lake, a hot tub, or just floating in space. Exhale slowly, let your whole body float. Now, please notice how quickly and easily you can use your store of memories and fantasies to help yourself and your body feel better. And to reinforce that experience, please picture in your mind's eye an imaginary screen. It could be a movie screen or a TV screen or a piece of clear blue sky. And picture on it a pleasant scene, somewhere you enjoy being. So try to involve all your senses in this experience of being somewhere you enjoy. A mountain lake, on the beach, in a meadow. And notice how you can reinforce the physical sensation of floating in comfort with the visual aspects of the scene, perhaps the smell of ocean breeze, the sounds of birds, or whatever is in the scene that makes you feel most comfortable. And just engage yourself in that scene. And notice again how quickly and easily you can help yourself and your body feel more comfortable. Just drop your shoulders and let the tension flow out of your body. if you happen to have any discomfort somewhere in your body, imagine a sense of cool or warm tingling numbness, replacing the other sensations in that part of your body, and let it filter the hurt out of the pain. Each breath deeper and easier. And now, if you'd like, let's try dealing with one stressor in your life. So divide the screen in half, and while you keep your body floating, picture that one thing that is causing you some stress right now on the left side of the screen, but with the rule that no matter what you see on the screen, you keep your body floating and comfortable. But allow yourself to feel the emotions that come with this particular stressor. And now use the right side of the screen as your problem-solving screen. And think of one thing you can do to deal with the stressor on the left. It's not the only or even the best thing, but a good thing you can do. Each breath deeper and easier. And notice how you can think more clearly about approaching the stressor on the left as you keep your body comfortable and leave your mind open to finding a resolution on the right. Now take a few moments to reflect on what this means to you in a private sense, and we'll come out of the state of self-hypnosis by counting backwards from 3 to 1. On 3, you'll get ready. On 2, with your eyelids closed, roll up your eyes, and 1 open. Ready? 3, 2, 1. How are
Wow,
you guys feeling? Yeah.
I think that was the most relaxing online talk I ever gave. It actually works also in this context.
Absolutely. Absolutely. I do have a question for you, Dr. Spiegel. As we think about, self-hypnosis, how is it similar? How is it different to, mindfulness or meditation? And, should we be thinking about it differently? Does it actually even matter?
Well, there are similarities and there are differences. They're both altered mental states. And one thing to keep in mind is that altering our mental state is one of the most powerful coping strategies, as you know from the fact that if you got really upset by some email you read at 11 o'clock when you shouldn't have been reading emails and don't know what to do, you get a night's sleep and the next morning you say, oh, yeah, I know what to do with that. So changing mental states is one of our fundamental coping strategies. Both hypnosis and mindfulness involve a change in mental state. And sometimes just seeing the same problem when you're in a different mental state can make it seem less overwhelming and terrifying and help you deal with it better. So part of it is just changing your mental state, but there are differences. Hypnosis is a Western alteration of mental state. It's the oldest Western conception of a psychotherapy, actually. And it involves, it's task-oriented, which we are in the West. It's, solve a problem. Here's how you can, hopefully some of you may have had some improvement in your pain while you did this, or felt that you could deal with the stressor a little bit better. So it's meant to be rapid, focused, and problem-oriented. Whereas mindfulness from the East is also an alteration in mental state, but it's meant to be a practice that changes the way you address problems, but not necessarily something that will solve a given problem. So it takes longer. You're supposed to do it in mindfulness-based stress reduction, a half an hour twice a day, which is quite a commitment. But it can help people feel more calm. And the idea of mindfulness is to focus on scanning your body, being able to just be in touch with how your body's feeling, open presence, letting feelings just flow through you the way a storm would blow by, and cultivating compassion. Those are 3 major elements. It turns out that different parts of the brain are affected. So when you go into hypnosis, we found that you turn down activity in the salience network. It's a part of the brain that is on the alert for stressors of one kind or another, the anterior cingulate cortex, which is right here in the middle of my brain and helps us scan for what to worry about. With mindfulness, you tend to turn down activity in the posterior cingulate cortex in the back of the brain. And that's involved in self-reflection. When you're worried about something or you're thinking about yourself and what something means, you have activity there, and mindfulness turns down its activity there. So overall same region, but different parts of that region are involved in hypnosis versus mindfulness.
That's very, very interesting, and also this experience in the body that we just had. I mean, it's impressive how quickly you can get into that. And also, we are actually curious to hear from the other people from the audience, like what you felt. I saw a comment here, so let us know. And also, if you have a question for Dr. Spiegel, you can put that in the Q&A. So we will have some time for Q&A at the end of the whole session. Now, before we dive into the topic of support groups, I'm just curious, like what you just did, you guided us through this. Can we also do that for ourselves? Can we self-hypnotize us?
You can. I see Carol Robinson said, I would not have believed it, but my neck discomfort completely disappeared. So I am no longer a pain in the neck. I'm really glad to see that. Carol, yes, all hypnosis really is self-hypnosis. I'm not doing something to you. I'm helping you discover and utilize an ability that you have. And so it's something that everybody can learn to do. In order to try and help spread this around, we actually started we have a little startup called Reverie Health. And it consists of digital interactive apps that allow you to practice self-hypnosis with my mellifluous voice. I ask you questions, you give an answer. We have an AI algorithm that responds to your answers and alters the program that you would use. So we try to guide you along the way I would in my office. But really, if you have the ability, everybody has the ability to use hypnosis. And most people have done it in a way that they didn't identify as self-hypnosis, but just getting absorbed in a movie or a play, for example, is an example. So if you're interested, you can download from the App Store Reverie, R-E-V-E-R-I. I think Martin has put something on the chat, or at Google Play if you have an Android phone. And you can use the app to help practice stress management, treatment for insomnia, pain relief. And for those who unfortunately are still smoking, we have apps to help with that, and we're developing others too. And we have a little hypnotic minute that you can start the day with, a 1-minute self-hypnosis. We also have a website, www.reverie.com, if you want to enter it that way. So it's a safe and effective way of helping yourself manage your problems and your body and mind better.
Well, that's wonderful. I just was putting the link in the chat. So if people want to check it out, I think it's definitely something to take a look at. So thank you very much for this take on hypnosis. Now we know you also did a lot of research in the past years on the effectiveness of support groups. And that's where we would like to dive a little bit into now. Maybe you can walk us through what is a support group, or why does it work? You had some pretty interesting studies done, and maybe you can just give us a quick intro to that.
Sure, I'd be glad to do that. When I started my career here at Stanford, I was recruited in part by Irv Yalom, who is a well-known author and leading expert on group psychotherapy. And he and I both had an interest in existential philosophy and the idea that you don't really live authentically until you face, the possibility of non-being, which we all have to face in one way or another. And so he thought that perhaps getting people to confront and talk about their fears might be a period of growth. It's not just treatment for anxiety and depression, but a period of growth. And so we started running groups of women who had advanced breast cancer. And we were warned at the time that we would be demoralizing them, that, women might see another woman get sicker or even die from the disease, and that this would demoralize them. And what we found actually was that it was not demoralizing, it was remoralizing, that people, one woman said that, even dealing with death in the group, she said, it's like looking into the Grand Canyon when you're afraid of heights. You know, if you fell down, it would be a disaster, but you feel better about yourself because you're able to look. That's how I feel about death. I'm not serene, but I can look at it. And so we started these groups that met once a week for 90 minutes, led by several therapists. And we tried to keep the focus on the important stuff. So we first built bonds of connection. And this is what Parul, you and Martin are doing by sharing your experience with other people who are dealing with cancer. But it's very important to feel connected, because the experience of being diagnosed with cancer is an isolating one. Suddenly you feel removed from the flow of life, and everybody else is out there leading these happy, normal lives. And here I am dealing with this perceived death sentence, even though more than half of people diagnosed with cancer will live to die of something else. More women with breast cancer die of heart disease than breast cancer, you know, so it seems like it's the answer in the end, but it isn't. And so you form a connection that makes you feel you belong. Cancer patients instantly appreciate and understand what one another are going through. And to feel connected rather than isolated is a powerful thing. You know, we're social creatures. We survive on our ability to support and care about one another. So to feel cut out or isolated is very painful, and it's not necessary. We encourage the expression of emotion. You know, it makes my skin crawl when I hear cancer patients being told to, be strong, you know, don't, as though somehow if you just will yourself not to be upset about cancer, it'll go away, it'll skulk away because you're not paying attention to it. And that's just an extra burden that you don't need to have. We have an emotional expression system for a reason. It builds connection with other people. It helps us recognize and deal with what we're having. And saying that you're fearful or angry about cancer doesn't mean you're given into it. It means you're dealing with it. And so expressing emotion is a very important part of these groups. We encourage people to detoxify their fears, talk about their fears of dying and death. We're all going to die sooner or later. And so facing it doesn't mean you're giving into it. It means you're dealing with it. And that's a very important part of coping well with the disease. We have people reorder their priorities in life, as you both did. You know, if it's going to influence your life, then you need to find ways of dealing with it. And you've made it a part of your life in a very constructive and helpful way, but you're not giving up one bit. And so changing your priorities is a very important part of coming to terms with and dealing with it. We encourage people to improve communication with their families and friends, to be more open and honest about what they're dealing with to the extent that they're comfortable doing it, and make sure that everybody in their family and friendship circle understands how to help you deal with the illness, and you lead as active and normal a part of life as you can with your family and friends. We encourage them to clarify communication with physicians, get your questions answered, don't be afraid to ask questions, and participate in decisions about treatment, and symptom management like self-hypnosis. So we ended each group with a self-hypnosis exercise like the one that we all did together here.
Dr. Spiegel, I'm curious on your thoughts about how the effectiveness of a support group can vary, whether it's facilitated by a therapist or if it's just peer-based. You know, I am one of those people who, as a patient going through cancer treatment, was very intentional about trying to maintain a very positive and, you know, hopeful perspective. And yet at the same time that I was going through treatment, had a friend also going through chemotherapy, and her, you know, blogging, her mindset around it was much more negative, like kind of more venting and like, why is this happening to me? And I found it difficult to be surrounded by that, and was actually one of those people who were hesitant to join a peer and patient support group for that reason of, you know, being surrounded by that type of negativity. And wondering what your thoughts are around, you know, people's hesitation, as well as, you know, had it been more of a therapist facilitated environment, would that have been more effective?
Well, as a therapist, I would hope so. But you know, I understand it. And I would say, you know, part of what can happen, particularly in a sort of an unmediated group, is that certain, you know, one or two people can come to dominate the group and kind of set a tone. There's nothing wrong if you're feeling that, you know, obviously, you know, anybody with a diagnosis of cancer has some negative things to deal with, but how they handle that and how they address it and move beyond it is a very personal thing that can be very different. And there's no reason, if you were in my group and one person was sort of dominating with saying, this is terrible and I give up and my life is over, why me, poor me, I would encourage other members to share the kind of perspective that you have, Parul, and say, well, that's one way to look at it, but that's not the way I look at it. And here's how I'm dealing with it. And I kind of feel bad for you that you're, feeling so kind of overwhelmed by this real negative problem. But are there better ways for us to find to deal with it? And so the expression of emotion doesn't always mean the expression of agreement about things. And in a good group, people can talk about that and can differ about how they're dealing with it. And so I have some preference for groups that are led by experienced leaders who can help keep things on track, maintain respect for open expression of all kinds of feelings. And I think that can help. On the other hand, there certainly are some good support groups that are not leader-led. And the nice thing about this is if you can make it into something that is helpful to you, keep doing it. If you don't feel it's doing that, find another one or just stop. I mean, the good thing is you can pace yourself and dose yourself. And if you decide it's not helping you, you're the expert on that. So, do something else.
I mean, it's interesting because you just mentioned that it's a lot about being able to talk about your emotions and the stuff that you don't want to talk about. Now, I have to ask you this question because for myself, but I know also for a lot of men, it's not so easy to join a group and say, okay, let's talk about our emotions. It's actually something that I think, struggle more with it than women. I never joined a support group. I always was reluctant. I felt like, no, I don't want to go in a group and hold my hands and share like how I feel. I didn't felt like attracted to that. So what would you recommend to somebody like me or people in a similar position, or just like let's say I don't have the courage to go?
Well, I mean, you got plenty of courage, but I think it is true that men in general don't naturally express feeling as much. And so frankly, they do it less, but I think they need it more. I mean, a man's general notion of expressing emotion is, I like beer. That's kind of the depth of it. And women will more often talk and share with one another. And that's why, for women, strong relationships are a combination of receiving, but also giving support. Whereas the research on men's, for example, effect of marriage is that it helps them more than they help others. So having a relationship with a woman is good for your health, regardless of your own gender, and having a relationship with a man is not as good for your health, regardless of your own gender. In fact, married cancer patients live on average 4 months longer than unmarried cancer patients, all other things being equal. So I think what women tend to do, the expression of emotion, I think is tremendously important. And it doesn't mean giving into it. It doesn't mean, being ashamed of it. There's actually a support group for men with prostate cancer called Us Too. And they named it that way because they say women with breast cancer are getting all the emotional support and we're not. So there are men who recognize that. And I can remember an episode of we had a group for the spouses of women with advanced breast cancer. And this one man said, I was trying to cheer up my wife, and she ran a company, a tech company here, and she was on the floor in the living room so weak from the chemotherapy that she couldn't get up. And she was crying and upset, and I was trying to cheer her up and I couldn't do it. And he said, and she was just getting angrier and angrier. And he said, so you know what I did? I started crying and I got down on the floor and gave her a hug, and a big smile came on his face. And he said, you know what? That was the right thing to do. So talking people out of a real problem just ain't going to work. It just alienates you. But saying, I feel it, I feel bad about it, how can I help you with it? It connects people. It doesn't deny the reality of the problem. But as with mindfulness, it helps you sort of move beyond it. I have the feeling, I'm experiencing it. I'm not going to cry forever, but I will for a while. I've never lost a patient at terminal crying. They start and they stop, and they usually feel better afterwards. So
I love that.
Yeah.
I love that. I mean, I just gonna add as a quote, as a man, I think it took me a long time. I always thought like it needs a lot of courage to be strong, but actually it needs much more courage to show weakness. And it's something we struggle with. We think always we have to be strong, we have to be the provider, we cannot be weak. And that's an expression of being strong, but actually like showing that you're also weak is even stronger. Yeah, but it takes time. It does.
That's beautifully put, Martin. That's absolutely right. Absolutely right.
You know, Dr. Spiegel, in times like now with COVID or during lockdowns, or for people who don't necessarily have access to some of these specialist resources, you know, what do you recommend in regards to how we can still seek or foster this type of therapist-led, you know, and productive support groups, even in these crazy times?
Yeah, it's hard. There are virtual groups that can work surprisingly well, actually. In fact, we did an early study of a support group for breast cancer patients at a time when we didn't have this beautiful video now that we're all experiencing. It was all just typing, you know. And the thing that was amazing was that even despite the fact that people were just reading one another's typescript, the groups were surprisingly effective. They work remarkably well. And so the technical limitations are not something that needs to define what you can do. So we can communicate, we're sharing experiences now in a meaningful way. And there are now many support programs that provide groups that you can sign on to and you know, use the Zoom links or others that people do. And I think they can be quite helpful. And I think, you know, I'm sorry about this phone here. I can't. I do think that, you know, one of the things that is unfortunate about the whole COVID experience, other than, you know, the threat to all of our lives, is that we missed an opportunity, particularly early on in this country, to recognize how we could be a community that was helping one another. And this whole foolish debate about masks that has cost, I think, you know, tens or if not hundreds of thousands of lives, is that wearing a mask is not an attack on your personal freedom. It's a way of identifying you're caring for the people around you and you're being part of a community, that we will survive this to the extent that we do provide mutual support to one another in an obvious way. Wearing a mask protects the people around you more than it protects you, and that's fine. That's what we do for one another. And so the idea that we just, you know, are isolated individuals, you know, toughing our way through it rather than acknowledging a problem and doing things to help one another was a terrible mistake. It still is, even though things are getting better now, in part because of the masking as well as the vaccination. So I think, you know, COVID is another opportunity, like with cancer, to recognize that it's an opportunity for us to emphasize our humanity and find our way to help one another in dealing with this very difficult situation.
I totally agree. And I actually think this online session is just an expression of that, because when I'm looking at the chat and I see how people are sharing like their links to their support groups, and people find each other now through a session that would not have been, let's say, produced without COVID. I mean, I'm logging in from Switzerland. I think it's also an expression of like how you can react to a situation and make the best out of it. Yes, and I think that's what also support groups can be around. So there are a lot of resources out there where you can connect with other people having some similar thing. We're coming slowly to an end from this session, and I want to have enough time for Q&A. Now, what do you think, Parul?
Yeah, I agree. I do have one reaction to Dr. Spiegel's earlier comment that I'd like to just circle back on a question with. You mentioned how, you know, in previous worlds and times, support groups were more like just writing to each other. And, you know, when we think about the forum or the medium in which support is shared, to what extent does it matter? Whether it's, you know, live in person or virtual and this type of video experience, or even just an online sort of discussion board where it's just typing, does the impact of the support and the benefit that comes from it, you know, vary or be optimized in one format or another?
Well, Parul, it's a very interesting question. And I think oddly enough, this miserable pandemic has opened up a whole series of opportunities. We now are able to communicate. Is it exactly the same as being in a room with 12 other people? No, but the fact that Martin, you in Austria and we here can be communicating in real time, looking at one another, reading one another's emotions, is a tremendous opportunity. And it means, we're finding at Stanford, we had before the pandemic, 5% of our psychotherapy was done virtually, and 95, we did a complete switch. And now at least a third of our patients are saying, you know what? I don't want to go back to having to take off an afternoon and drive to your office and find a parking space and wait and go. I want to keep doing it that way. So does it solve all problems? No, but I think the opportunity for human contact in this way is a tremendous one, and a tremendous advantage that we can make much better use of in making connection with one another and providing interaction and support. And so I feel good talking to you two guys, even though, we're far apart and may never see one another physically. That's okay. The human mind has a tremendous possibility for coupling imagination with reality. So I can get a lot of feelings and make a lot of assumptions just looking at the two of you and talking to you, that I could do if the visual weren't there, but it would be harder. And so let's take advantage of our capacity to combine imagination with reality and make the most of it.
I love that. What a wonderful closing word. And I mean, also another point to add is what is really wonderful about this kind of session we're doing now is we record everything. So if somebody wants to rewatch it, or a friend who wants to rewatch it, we will send out the link to your email once it's over. So Dr. Spiegel, thank you so much for your time and sharing with us like all these interesting, not only the research, but I think also these practical tips. I learned a lot again. So it was really a pleasure. Thank you for taking the time.
Thank you for having me. It was a pleasure talking with you both.
Thank you.
You're welcome.
All right, we do have some questions.
Okay.
I think so, yes.
All right, I'm going to jump in with a practical question from one of our oncology nurses, Dr. Spiegel, who says that it's impossible to get an appointment to see you for hypnosis. Could you let us know if there's an alternative internal or a local resource for the interest that may be generated by this program in people who actually want to seek a consultation?
Well, part of why I developed Reverie was that I was frustrated by the fact that I didn't have the time. I've used hypnosis with about 7,000 people in my career, and that's a lot of people, but I couldn't reach all the people who wanted to get this kind of help. And so the app is one approach. We do have two other superb psychiatrists at the Center for Integrative Medicine, Manuela Kogan and Ripple Shaw, who are also experts in hypnosis. And there are a number of other experts in the community. So please make a referral to the Center for Integrative Medicine, and one way or another, we will try and find the help in the local area that people are looking for.
Another question that was in the chat, and I'm sure is also in the minds of many people who are listening to this, and certainly comes up in our cancer treatment areas, is exercise. It's often mentioned as an amazing way to control stress. So question is, the questioner, Eileen Raymond, says, I find my lack of energy due to cancer therapy makes exercise less doable. Any ideas?
Well, Martin is the living example of the power of exercise in dealing with cancer. So Martin, you may have some thoughts about this too. I would just say one way to think of it is that while it is true that chemotherapy can really drain you and just dealing with cancer can, I would say take small steps. And so if you're not going to go out and run a marathon, go out and walk around the block, and the next day try and walk around 2 blocks, and try and find something that is challenging enough to be useful but is not overwhelming. And any of that you do is better than not doing it. So take those little steps and see if you can gradually build on them. You will enhance your body's ability to deal with the fatigue that comes with cancer, and potentially to help in other ways too. So do what you can. But Martin, you might have some thoughts about that.
Yeah, no, it's interesting that you share that tip, because I would just have said something very similar. Like when you go through treatment, your body is so drained by the side effects. So suddenly a little task becomes a really, really big challenge. So maybe the task of the day is just that you walk by yourself to the toilet, and that's like a training. So I think what a lot of people like get stressed about is that they believe they have to like have this kind of training of this big step, and it's not, because your body is really, really weak and you should take it slow. So I started actually to use a hashtag that goes like this: go easy but go. And I like that. It's really go easy but go. It's not such a matter of like how far you go, it's more a matter like that you go, and that will help your body. Yeah,
that's a wonderful idea. And the stress management part of that is to think in more or less, not all or none terms. It's not I can do things and run marathons or nothing. It's how much can I do? And if you think, and the same is true with your concerns about cancer, it's not great, but there are other things that could even be worse. And so here's what I'm living with. Here's how I'm going to live with it. So think in more or less, not all or none terms. And that's very consistent with what Dr. Crum was saying last week too, that if you have a mindset, don't let it be hijacked by the negative. Think in realistic but positive ways, as Parul mentioned.
Well, I love the concept of small steps. And I also love what Vanessa posted in the chat about celebrating every victory, no matter how seemingly small as well. Right. So it's a combination of taking those small steps and just going, like Martin said, but then also reflecting on that as being a win, and, congratulating yourself for each of those steps also.
Excellent point. Absolutely.
And there's a follow-up comment or question that I have for all of you, and that is, what if your body feels weak? Somebody is saying that, for instance, that being a runner, it was really difficult when the body just couldn't do what the body had done. Do you have any comments or wisdom for people who feel that way?
Yeah, there's a saying, it's like one of these glasses half full or half empty things. Somebody said the difference between an optimist and a pessimist is an optimist says this is the best of all possible worlds, and a pessimist says you're so right. Focus on not on what you've lost, but on what you've got. And so, yes, compared to what you may have been like 5 years earlier, your body has a lot less energy, but it doesn't have no energy. So try and keep the focus on what you can do and on changing it, on not feeling totally helpless with it, but on saying, okay, I'm going to have to build it back up. It's like rehab. You break your leg, you got to go through rehab after the bone heals. And so in a sense, that's where you may be, that you're sort of been thrown back a bit, but you want to see the extent to which you can rebuild your body's strength and ability to do things.
I'm happy to share a little anecdote. Oh, sorry, Parul, go first.
Yeah.
Go for it.
So I can share a little anecdote. Like in January, I had another big surgery, and they always make a big cut over my belly. So all my belly muscles are falling apart. And so I like to do yoga, but when you have a big cut on your belly, you cannot do yoga anymore. And so I talked with a friend, and she just had a baby, and she told me, look, why you don't try pregnancy yoga? And I found it a super idea. So I went on YouTube and I Googled these videos of these pregnant ladies, and it was perfect because it showed me which movement I could do and which I should maybe not do. And it was pretty absurd or humoristic, but it was really, really well guided. So like just accepting where you are and not like getting stressed that you are not running a marathon today. So yeah.
So folks, this is a strong man because he can do pregnancy yoga. That's great.
The best part was when they were saying, so, and now breathe into your baby. I was just like, oh my God, this is too much now.
That's amazing, Martin. I love that. I was just going to share that I, was a dancer all my life, like through childhood and adulthood. And, when I went through treatment, it wasn't just chemo treatment. It was also, a bilateral mastectomy and breast reconstruction, and the whole muscular makeup was so different. And when I went to even just my first dance class, now I used to be a performer, and this is just going to a class, And I realized that like lifting my arms up to do what otherwise should have been a very simple dance move for me was difficult. Like it felt different. I felt like I might pull something, and it was, harder than I expected it to be. And I think the important thing to remember is to have some compassion for yourself and just giving yourself grace. And there's this quote that says, take care of yourself like you are someone you love. And I love that, because if you were to think of a family member or someone that you love going through this type of situation, struggling with not being able to run when they love running, or not being able to dance in the way they used to dance, what would you tell them? Like, you wouldn't be as hard on them as you might be on yourself. So even just having a conversation with yourself, like you are someone that you love, what would you tell yourself? What compassion would you show? And take those smaller steps, because ultimately I did get back into dance. Ultimately, I did start performing again. And it wasn't the chemo and the cancer treatment that took me down. It was the knee surgery and the meniscus tear. It might be something else, but it is possible to get back into it. But just show yourself some grace along the way.
But there are two things. You still had another resource you hadn't lost, which is the special connection with an understanding of your body that dancers have. They need to have, and you were using that. And the other thing is compassion, not just for yourself, but for your body. We often get angry and frustrated with our bodies. Why are you letting me down? Why aren't you doing this? Think of your body as if it were a child. If a child is hurt or is not performing well, you don't get angry at them. You say, let me help you do better. And in a sense, that's what we owe our own bodies too. And that's what you showed by persisting through it, understanding what was going on with your body, and using your body to the point where you can once again dance. That's wonderful.
You are also amazingly wise. I'm just nodding and smiling. And I have a final question. It's in the last minute. Sarah says, I seem to go from denial, I don't have cancer, to I have cancer and I'm going to die. I can't find a middle ground. What might help me to find this?
Well, you know what I would do, and this is what would happen in a support group. You've got the perspective. You're asking a good question. Is how would you help someone else who's dealing with the problem get perspective? It's much harder on ourselves than it is when you see the problem in someone else. And you might even try it out with someone who also has cancer, and see if you can help them find that middle ground between despair and feeling overwhelmed and just pretending it's not there. And so if you do it with someone else, you'll start to do it for yourself.
I'd also add the notion around the Stockdale paradox, if anyone's heard of that before, but it's based on Admiral Stockdale, who had won the Medal of Honor in the Vietnam War and had been tortured many times. And when interviewed, asked how he handled, being this prisoner of war and how he handled how distressing that was, he said it was actually never distressing for him because he never doubted that he would emerge stronger because of it. And the Stockdale paradox became to be this ability to balance, those brutal facts of what your current reality is and what you're actually facing, but balancing that with optimism and hope for the future, whatever that time might be left. And so it's not actually just being optimistic and possibly delusional, but it's acknowledging that you are facing something difficult. There is this real hardship that's happening, and yet not losing faith that either you will emerge stronger because of it or learn from it in the way that for whatever time is left, you can be a better person from it.
Well,
That's great.
This has been a fantastic program. I know everybody joins me in thanking you very much, Parul, Martin, David. It's been fantastic. Thank you for joining us. I hope you can join us again in 2 weeks for our final sessions, and have a good day.